Good afternoon. Our project name is Secure Sharing of Personal Health Records on a Cloud. And our team members are Surve, Dhiraj, Thigale, Mansi, Amre, Snehal, and Bhosle Rutuja. Cloud-based service in the healthcare sector has resulted in the cost-effective and convenient exchange of personal health records among the several participating entities of the e-health system. So the patients can easily create and manage their personal health records. It contains information such as medical history of the patient. Personal health records are created and managed by patients and made available to those who need to access, so the patient can effectively communicate with doctors and other care providers to take advice related to the health. While sharing the confidential information over the public network, it can be viewed or modified by the attackers. Thus, we need a system to provide security and privacy to this patient-sensitive data. So we present a methodology called as a secure sharing of personal health records on a cloud. The methodology preserves the confidentiality of personal health records by restricting unauthorized users. For example, uh, if, it represents the insurance company may only be able to access the portion of the health record, while the other confidential information such as medical history of the patient is restricted for such a user. And this data is accessed by using KGC, that is Key Generation Center. Thus, we provide extra security to that data. Next slide. We studied some research papers and we observed that there was methodology for personal health records, but there will be no security provided to that system. So the third party can easily access the patient confidential. If we need to share the record with our doctor, it is exposed to public network, which is not secure. Thus, we need a system to provide security and privacy to the patient sensitive data, and hence the motivation behind this work is to propose a system which shares personal health records over the cloud confidentially and securely. Next. The aim is to develop a secure sharing of PHR is to propose a system which securely share and maintain its PHR on cloud using Java. In critical movements, we need the patient health information in real time. So this application will be interface between both physician and patient and provide secure, trustful, and reliable communication in healthcare area and efficient service. So this is the main objective of the system because right information at the right time saves a life. Next, storing the private health information to the cloud servers managed by third parties is susceptible to unauthorized access. Privacy of the PHR stores in public clouds that are managed by commercial services providers is extremely at high risk. The PHR in a cloud storage may be susceptible to unauthorized access because of the malicious behavior of external entities. So, the problem of data exchange between medical units is solved in this system.
This is Hope. The proposed scheme is able to resist internal and external attacks. It means it revokes the account in internal attack, and in external attack, it resists by using cryptography. The generation of keys and the algorithms are simple, and the proposed scheme overcomes the dynamic access control problem. Here the preferred technology is for user interface, HTML, CSS, and JavaScript is used. For backend, Java is used, and for the database, MySQL is used. System requirement, software requirement, programming language, Java 1.8, database MySQL 8.0, IDE NetBeans 8.2, and hardware requirement, hard disk 120 GB and RAM 4.
So this is our system architecture. In that the patient whatever send the information will be uploaded to the cloud in an encrypted format. So here healthcare staff is a user and the patient is a PHR owner. That is a patient health record. Trapdoor generation is a concept which is we used in our project. The file is encrypted format. No one can read it without a proper decryption. But the user has the permission to search the file. We can do this through trapdoor generation of a keyword trapdoor and keyword search. The encrypted file is which is uploaded by the patient or a owner of a PHR is stored in a public cloud. And when the healthcare staff, that is the user, send request to the search the encrypted file through uploaded trapped generation, then the public cloud reply to the request, that is the whether the search file is there or not. If search file is found, the request sent to the PHR owner, then the PHR owner generates a key. It is a one-time can given, and it generates one time, and KGC is a key generation center. The key is sent to the healthcare staff. Then by using the key, the file can be decrypted and they can be retrace the original file. Then there is the verification of the healthcare staff verification. Follows that only the particular staff or a person the allowed given a key and nobody else is using this key. Sometimes person in the staff can sell the secret key for his own profit. So that are the after verification, particular staff can he held responsible for such a issue. So staff can more able to access the files and block from receiving such a type of a secret key. So these are the last concept that is called traders identify. We have added one more security trap, that is somebody still gets the illegal access of the file, then also they cannot access the original file. So here is our conclusion. We propose a procedure to safety store and transmission of the PHRs to the authorized elements in the cloud. The strategy of it preserve the security of the PHRs and authorize the patient-driven access control to various segments of a PHR on the access provided by the patients. The PHR owner stored in the encrypted information on the cloud and just approved user having valid re-encryption keys issued by a semi-trusted authority can decrypt the PHRs. The job of the semi-trusted authority is to procedure and store the public and private states for the clients in the system. Thank you.